So bicoastal vitality is our child that we're going to give birth to and create from the beginning. It is a holistic and medical approach to patient needs, patient diseases, patient's medicines, patient's diet, patient's exercise, patient's health, mental and physical. And by looking at a person as a whole person, including lifestyle, including stress, including work, including medical problems, blood work, diet, all of this will create a wellness, and we are capable and we want to help people to feel more healthy, more enjoyable, more loved, and health and happiness to everybody. Namaste.
So tell us what made you decide to become a hospice doctor.
When I graduated from my residency, I started doing house calls, which is a little bit different from traditional office seating medicine.
I can attest to that.
And I started to see patients at home. Usually those are older population, somebody who is bedbound, homebound, on a wheelchair, unable to see the doctor in the office, does not have transportation or doesn't have family members who will bring patient to the doctor. So as I went along, very complicated patients, very sick patients, their emotional state, their stress level, as well as their caregiver stress level, brought me to start work in hospice. I joined a hospice here in New York, and 2 years after I took my boards. So I'm hospice board certified physician. And I think this type of work gives me us in terms of a little bit of ease to the families and to the patients. It's a very psychological, difficult type of work when most of your patients are about to die or dying. And sometimes my days start with 4 or 5 deaths. And those are patients that I've been attached to, those families that I know struggling. Some of the patients are young patients, some of the patients are older patients. The cycle of life is very different for everybody. Some patients take it as it's part of life. Some patients are in denial. So I help them go through psychological as well as medical relief in that sense. And that's what led us to create another
charity
or another part of work that we are doing now. I started going into patients' home. I have noticed that class population was, as a majority of patients, was in severe in terms of approach and also durable medical equipment approach. So people who have no money and are Medicaid eligible are capable of getting things like hospital beds, like alternative pressure mattresses,
even diapers,
pull-ups, chucks. People who have more money, but this is 2 or 3% of population, are capable of buying those things. As soon as you tell them, oh, your mom might need alternative pressure mattress, their family members are able to spend a couple of $1,000 and just buy it right away. For middle class population, it is a disaster. So to get diapers, we have to go through insurance authorizations. To get home health aid at home, we have to go through insurance authorizations, and the most patients can get 4 hours, 3 days a week, which is nothing for the patient who is homebound and bedbound, unable to cook, unable to clean, unable to walk to the bathroom, unable to turn in bed maybe.
Yeah.
That's what led us to open charity. So the way it's all started is a little bit funny. So one of the patients passed away, and Dora called us and she said, listen, I have tons of diapers left, and I have chucks, and I have hospital bed that I paid it off. Do you guys need it? And all of a sudden we thought, oh, one of our patients actually needs it and cannot buy it and cannot get it. So we said, okay, we will pick it up from you. So we picked it up and brought it to another patient. And family members were so grateful and so happy, to the point that, oh my God, they started crying. So that led us to tell patients and family members, if you have something extra, if you something you don't use, if you something you bought you might not use, we will gladly take it. So it got to the point where Kristen's garage is filled with durable medical equipment. And when we see that patients are in need of Ensure, of Glucerna, of chucks or diapers, we just bring the box and take it to patients' homes. And of course, it's good to have more organized than we do. And hopefully with time, it's not going to take the space of the office. Office is piled with equipment now. We don't even have place to sit. As well as your garage. You have to park your car in the garage. So that's why we have opened Bicoastal Vitality charity part. And we're hoping that people are happy to donate things, will be happy maybe to donate even money so we can get a storage. And maybe with time we can get home health aides trained. Obviously, we need home health aides from the agency to hire for people who are in need.
Well, our big goal is to, with Homebound Humanity, which is the charity, we would like to train our own home health aides because they don't have the proper training always. So we'd like to do that. We would like to start a pet program because these patients, not only do they not have supplies, they're so lonely. We already work with Wagner College, the PA students, they go and visit them way a week, and they're so grateful for the company. It's very sad. And this is my first time in doing home visits with Dr. Koroleva, working for her, and it just touched her. So that's why we started it. It is an official charity now, and we do have a GoFundMe page. So any help that we can get would be greatly appreciated for these people.
Again, I want to emphasize Bicoastal Vitality is not purely holistic approach practice, and it's not purely weight loss practice, and it's not purely traditional medicine practice. We're all in one. So we look at the person and treat the person if it's needed medically. We don't treat complicated conditions as cancers holistically. We don't treat diabetes, which is not controlled purely by diet or by supplements. We supplement it all together. If person comes in with very uncontrolled diabetes, of course they're going to start on medicines, but at the same time they will start on a proper diet. They will start with proper exercise, with the proper osteopathic manipulative therapies, with the proper supplements, and also traditional medicines like insulin, an example. But as person is getting used to the lifestyle of eating healthy, exercising more, losing weight, and their hemoglobin A1C improves, we will try to take them off traditional medicines in a proper medical way, not purely stop your medicine, will do holistically, or continue your medicine like in traditional medicine. There is no way for the diet or exercise or supplements in your regimen. So that's our approach of treating person as a whole person, looking at the problem, the whole problem, and of course, helping people to get used to it, to become as a lifestyle. We're all approachable. I'm always there when patients need me to talk to. Kristen is also there always, as well as a chief. That's it.